Welcome to www.texas.healthsourcechiro.com/city/law-port. Today's topic, how to tell when injuries are serious. If you're at all active, particularly in sports, you know that injuries are just part of the game. The real question is how to tell if your injury is serious enough to warrant medical attention. Most weekend athletes tend to be too cautious when approaching their doctors for assistance with injuries, and thereby set up a cycle of chronically re-injuring themselves. By the point they go to see a doctor, their injury has become truly serious and recovery takes much longer. Here are some things you should look for and basic treatments for more minor injuries. Finger injuries. Finger injuries are remarkably common if you play basketball or football. In the home, lacerations and even amputations are not uncommon. You want to see your doctor if there is any deformity, unstoppable bleeding, numbness, if you see exposed bones or tendons, or your finger turns blue. If you have a clearly deformed finger, then try to splint it to something rigid in the least painful position. If you're bleeding heavily, apply pressure, preferably with a clean cloth, and head to the ER. If you have amputated a finger, take the digit, rinse it gently with water to clean it if needed, put it in a plastic bag, and place the bag in ice water. Take it with you to the ER. Usually things can be reattached if you arrive in a timely manner. Head injuries. Fractures, internal bleeding, and closed head injuries can all result from accidents or rough games. Emergency care should be sought for all serious head blows, even if you haven't lost consciousness. If the injuries result in confusion, dizziness for more than a few seconds, drowsiness, an inability to talk or walk, vomiting, or a severe headache, don't delay getting medical attention. For a minor head injury, banging your head on a doorway or roughhousing and hitting the floor, ice should suffice as long as there's been no loss of consciousness. Knee injuries. Your knees have numerous ligaments that give you such range of motion and flexibility. Unfortunately, that also means that your knee has many ligaments that can get stretched and torn if pushed too far in the wrong direction. It sounds a bit like alphabet soup. ACL, MCL, PCL, and LCL. The most common ligaments damaged are the ACL and MCL. When they give out, you may hear a pop, accompanied by severe pain that comes on suddenly. You can end up with a highly unstable knee joint that buckles under demand. Ice and painkillers help control the pain of the injury, and some of the ligaments can be repaired surgically if they're sufficiently damaged. The crucial ligaments, the PCL and ACL, can only be reconstructed, not repaired, and the repair is complicated. The MCL and LCL can be repaired surgically, and recovery is usually satisfactory. Don't use an injured knee until it's completely healed or you're asking for trouble. Everyone will agree that injuries are simply no fun. Stretching, working within your limits, and being aware of your surroundings are the best way to prevent serious injuries both on the field and at home. Take care of your body. You don't get another. For more information on topics like this, go to www.texas.healthsourcechiro.com/city/law-port.